Good afternoon, everyone. I'm Paula Ferreira. I'm an osteopath and researcher, and I will talk to you about the global neonatal osteopathic care framework. It's an initiative from a multi-country research group hosted by the Center of Osteopathic Research and Leadership from the Health Science University in the UK. Picture a preterm infant in a neonatal intensive care unit, tiny, vulnerable, fighting for every breath. And now imagine if we can reduce the length of stay in about 4 days. So this is science and doesn't require high technology, but needs skilled and trained human touch. Osteopathic care is a non-invasive kind of manual medicine, and especially in the pediatric population, we use a very gentle touch for evaluation and hands-on treatment, and with the goal of improve the self-healing skills or capability of the preterm. And what we do, osteopaths with a gentle touch, it will try to help what the body is already doing, try to going through the health. And the osteopath care is classified by the World Health Organization as one of the TCIM. So the problem here is that every year, 2.4 million newborns die globally. Millions more spend weeks in the NICUs, separate from the families, and accumulating devastating costs. And this matters because behind every statistic there is a family stressed, and also a health system strained because of it. So healthcare systems need interventions that are effective, safe first, effective, and cost efficacy. And also that can be implementable in European, for example, high-tech in ICU, but also in limited resource setting. So the solution, our framework, is based on RCTs and systematic reviews, showing that when we combine standard care for preterm babies with osteopathic care, just 20 to 30 minutes of treatment twice a week, we can reduce 3.9 days the hospitalization stay. That means that save more than 2,000 euros per infant, and 68 reductions on prolonged admissions in the premature babies, and safe, no complications, zero. We have a bunch of evidence that osteopathy for the pediatric population is safe. So more than that, we have more than 250,000 osteopath professionals around the globe in 46 countries across all the World Health Organization regions. So it's safe, it's cost-effective, and there are professionals trained to offer the osteopathic care. So the research shows physiological improvements, outcomes as decrease in heart rate, increased oxygen saturation, reduced gastrointestinal complication, and the reduced length of stay. So our framework is adapted to everywhere, from the European NICUs to low, middle-income countries and rural clinics. And it's the same evidence-based approach, culturally tailored, because we're talking about treating with hands. So the impact of our innovation is, for the hospital, saving resource. That can mean more nurses, more beds, more capacity. For the families, 4 fewer days of separation, so less stress and financial strain. And additionally, fewer days of hospitalization can impact successfully breastfeeding That means health and immunoprotection. So we have a robust evidence, we have global infrastructure, we have a cultural acceptability. What we need support from the World Health Organization, regional offices, national healthcare systems, training institutions, and policymakers to make it happen. So we have everything, it's ready for implementation. And our framework shows that when we combine wisdom, traditional touch, with scientific validation that we have, we can transform outcomes for the most vulnerable as the preterm babes. So I think that every babe deserves the best in the start of life, and every health system deserves cost-effective and evidence-based solution. So for us, gentle hands, robust evidence, and global impact. Thank you for your attention.
Thank you. Any questions?
Yeah, thank you very much for your interesting talk. You talked about incubator and ICU. Some of the premature babies are in kangaroo or the skin-to-skin treatment. So this is another way of ICU, a low cost. Have you tried to see the effect of your treatment on the non-ICU low-cost incubation alternatives?
Thank you for your question. Actually, we don't have research in this population. We have in ICUs, and the service is still going on in Italy. There are 10 hospitals providing this, and some in France. But we have to search in this population, but we believe that as we are providing touch and it can be adjustable to all the cultures and even in rural situations. Yeah.
Thank you. Thank you, Anna. And